In the chapter of Preventive Medicine and Obstetrics, Pediatrics and Geriatrics, in today's session we are going to discuss about the perinatal mortality rate. So we see that the perinatal mortality rate, as the current definition, the term perinatal mortality rate includes the babies which are born dead, that is the stillbirth, the babies which are born dead, that is the stillbirth, and the babies who are dying within the 7 days of birth. Okay, the stillbirth plus the babies dying within the 7 days are considered to be the perinatal mortality or the perinatal mortality rate. So we see that the babies who are born in who are dying in the early 7 days are also known as early neonatal death. So we'll discuss in detail. So what is the perinatal period? Perinatal period will last from the 28 weeks of gestation to the 7 days after the birth. So the 28 weeks of gestation to the 7th day of after the birth is considered to be the perinatal period. According to the World Health Organization, the perinatal period starts from the 22 weeks of gestation to the 7th day of the birth. That is the perinatal period. The deaths which are occurring during this time period is the perinatal mortalities. Now, what is a viable child? For the perinatal statistics, to include the babies under the perinatal statistics, which means the late fetal death, the live birth and early neonatal death, we have to have a certain criteria. So that is the viable child. To include in the perinatal statistics, we have to include to include a baby under the perinatal statistics, he should be weighing above 1000 grams of weight, which will be equal to the 28 weeks of gestation. So the baby chosen should be above 1000 grams. Okay, it should be above 1 kg, more than 1 kg. And the birth weight, if it is not available, you have to go to the gestation period, which should be at least 28 weeks. It should be at least 28 weeks of gestation for the baby to be considered viable or live. Okay, alive. To be considered alive or viable, the baby should be at least completed at least 28 weeks of gestation, which is equal to the baby weighing more than 1 kg, at least, or more than or equal to 1 kg. Next, when both of these two criteria, if you don't know the weight of the baby, whether it is more than 1 kg or not, or you don't know if the baby's gestation period is more than 28 weeks or not, if you don't know both of these, then you have to measure the body length of the baby. And we also have studied previously that in infants or the babies, we measure the body length in terms, we never tell it the height of the baby, we say the length of the baby. So the length of the baby should be at least 35 centimeters. So this is the preferred criteria, is the birth weight. Now we know the preferably we go for the birth weight. The birth weight should be more than 1000 grams, or the baby should have completed 28 weeks of gestation. When both of these are not found, you measure the length of the baby, which should be 35 centimeters. So this was about the viable child. And we know the perinatal period, what we studied, 28 weeks of gestation to 7th day after the birth. According to the World Health Organization, it is starting from 22 weeks to the 7th day of birth. This is the perinatal period, and the deaths which are occurring during this period are the perinatal mortality. Okay, so now let us understand the next part, that is the perinatal mortality rate, the formula for the perinatal mortality. So we know that perinatal mortality includes the stillbirth and also the births which are occurring within the 7 days of birth. So we see that the late fetal deaths, that is the stillbirth, the baby which is born is dead. Okay, the dead baby being born, the stillbirths, and also the early neonate, that is the baby from day 1 to day 7 is a early neonate. So the deaths which are occurring, that is the stillbirth and the early neonatal deaths. The stillbirth is from 28 weeks. Okay, to the plus 1 to 7 days. So you can say the stillbirth plus the early neonatal deaths divided by the total live birth into 1000 is the formula for calculating the perinatal mortality. What is the perinatal mortality rate? The total fetal deaths, that is the late fetal deaths, that is the stillbirth, and the early neonatal deaths divided by total live birth into 1000. So what does it include? It includes the deaths from the 28 weeks of gestation. So we know from the 28 weeks of gestation, the deaths which are occurring from 28 weeks of gestation plus the first week of life, that is the 7th days of the after birth, 1 to 7 days of birth, the first week of life, the deaths which are occurring from 28 weeks of gestation to the first week, okay, to the first week after the birth, includes the perinatal deaths. And it also includes the late fetal deaths, that is the stillbirths and the early neonatal deaths per 1000 live birth. The formula we have written it in the form of words, okay, if they ask the definition. So this was an MCQ, then they did not ask the formula, they asked the MCQ, we had it in terms of words or in the terms of sentence. So we see that you have to remember it includes the deaths from the 28 weeks of gestation to first week of life. It includes the late fetal death, that is the stillbirth, and early neonatal death. Early neonate is who? 1 to 28 days. In that, the early neonate is from 1 to 7 days per 1000 live births. This was the formula and an MCQ which was on. Again, we have an underlined part, that is again another MCQ. The indicator of obstetric and pediatric neonatal care is given before and around the time of birth in the country. So we see that this perinatal mortality rate gives us an indicator of the care. What was the type of the care given? How effective and how good was the care given? The obstetric care, the pediatric, in pediatric, the neonatal group. Under the pediatric group, what was the care, how effective care was given before and around the time of the birth or the delivery in the country. So the perinatal mortality rate is an indicator of mortality rate is an indicator of obstetric and pediatric care which is given at the time of birth in the country. In India, 23 perinatal mortalities are occurring per 1000 live birth. So sadly, we see that 23 babies out of the 1000 babies are either born as dead, the stillbirths will occur, or they are dying within the 7 days after the birth. So the 23 babies are dying out of the 1000 babies because of this various causes which we will discuss in the next slide. So this was about the perinatal mortality. Now we move on to the causes. So what is the cause of this death? Now we saw that the babies are dying. So okay, yeah, sorry, so we saw that the babies are dying from 28 weeks of gestation. Some dead babies are being born. Stillbirths are occurring. Plus the babies are dying in 1 to 7 days. And 23 babies out of the 1000 babies are dying. So what is the cause for the death of these babies is what we are going to discuss. The cause includes the antenatal cause, intranatal cause, and postnatal cause. So how can we remember this? So what did we see, guys? Birth, okay, this is birth, 28 weeks of gestation, from the 28 weeks of gestation, so that is the antenatal period, okay. Antenatal causes will comprise this from the 28 weeks of gestation to the birth. From 37 to 42 weeks is the term, right? Birth will occur during this weeks, followed by postnatal causes 1 to 7 days. So we know the time period. Now let us relate the causes and understand. Now the antenatal cause could be during the pregnancy, right? From the 28 weeks of gestation it starts. So the deaths are occurring at least from the 28 weeks. If it starts, it is considered to be the perinatal mortality. So we see that it could be because of the maternal diseases like the hypertension, diabetes, anemia, And it could be the pelvic diseases, it could be maternal systemic diseases like hypertension, diabetes, and also the chronic illnesses like anemia. And we have pelvic diseases. Anemia could be because of the pregnancy as well, and these are the chronic illnesses like hypertension, diabetes, and all systemic illnesses which is present in the mother, which is leading to the perinatal mortality. Next, we have the pelvic diseases, which includes endometriosis and the ovarian tumors. Okay, the endometriosis. So, the endometrium being lodged in the other sites other than the endometrium, if it is lodged in the other sites, it is endometriosis. And ovarian tumor. So, in the ovaries, there is a tumor, huge tumor. Okay, so the ovarian tumors and the endometriosis could be the death, cause of death. And next we have anatomical defects, if there is uterine anomalies, if there is placenta previa or abruptio placenta. So we know that in cases of placenta previa, the placenta will be attached in the cervix, abnormally attached in the cervix. And abruptio placenta, the placenta gets detached, early detachment of the placenta occurs. And incompetent cervix could be another cause of the perinatal mortality. So we see that incompetent cervix is the one. Now generally what happens, the cervix will be like a plug, completely closed, adhered, so it doesn't allow the baby to come out until the 37 to 42 weeks when the term occurs. So the slow dilatation of the cervix occurs, that is 1 centimeter per hour. All of this we have studied in OBG, resulting in the slow dilatation of the cervix, and the baby will be delivered out. But here we see that in cases of incompetent cervix, the cervix is unable to hold the baby competently. It is not able to hold the baby very nicely. So what happens, the dilatation will occur very soon in the women, resulting in the incompetency, that is the cervix becomes incompetent, and the death of the baby can occur, bleeding and death of the baby. So we see that the what were the causes. Now let us summarize these antenatal causes, guys. What did we see? Systemic illnesses in the mother, maternal diseases like hypertension, diabetes, anemia, etc. Then we saw the pelvic diseases, that is the reproductive tract, and in that we saw endometriosis, ovarian tumors. Then the anatomical defects. In the anatomical defects, uterine anomalies can also be there. The uterine anomalies could be there, and the placental insufficiency and the placental abnormalities like placenta previa, abruptio placenta could be seen, and incompetent cervix. Apart from these causes and antenatal causes, we also have the toxemia of pregnancy, the malnourished mother, malnutrition of the mother, and antepartum hemorrhages, the congenital defects. All of these fall under the antenatal causes as well. Also, when the mother's age is advanced, okay, the TB, all of these will be cardiovascular diseases which are aggravated during pregnancy, leading to the death of the baby as well as the mother. So obviously if the mother dies, the baby also will die, and very rarely the baby will be saved. So the perinatal mortality occurs because of the antenatal causes. And next we have the intranatal. So we know that during birth, this was from the 28 weeks of gestation. We also saw toxemia of pregnancy, malnutrition, and antepartum hemorrhages, that is placenta previa and abruptio placenta. We have already seen congenital defects. All of these are also included in antenatal causes, if you want to write some more extra points. Next we have intranatal causes. In the intranatal causes that is occurring during the birth, there could be birth injuries. Injury can occur during the birth. And then we have asphyxia. And next, along with asphyxia, there is obstetric complications. So we see that there could be an obstructed labor, the presentation, the lie cannot could be not normal, abnormal lie, abnormal presentation of the baby. It could be breech presentation. So these could be the intranatal causes. And the birth injuries which are done during the the delivery, if the unskilled people do, if the home deliveries are occurring, then they can lead to birth injuries. Also while doing this suction, vacuum and everything, they can result in some birth injuries. And asphyxia, asphyxia wherein the baby is not having a required respiratory exchange of the air, oxygen, and as a result the blood supply to the brain is reduced. The oxygen rich blood supply to the brain is not available. As a result, it is leading to the death. Asphyxia, where the oxygen exchange is not occurring normally. And then we move on to the postnatal causes. So this was the intranatal cause. Intranatal, during birth what all can happen? Injuries can occur. Before going to the next thing, we'll first summarize this. During the birth, what can happen? Injuries can occur and some complications can occur, obstetric complications. Okay. Then lastly we have the asphyxia, asphyxia neonatum, you might have studied. Okay, asphyxia could occur as soon as the baby is born. Asphyxia can be seen. And then we move on to the postnatal causes. So we know that from the 28 weeks to birth, and then we have 1 to 7 days, that is the postnatal causes. Postnatal causes includes the prematurity, the premature baby. You can see the premature baby here. The premature baby, which is the most common cause of neonatal deaths in India, is the premature babies, the low birth weight babies who are born prematurely and weighing very less. They are the most common cause of death. Next, the respiratory distress syndrome. So we have the respiratory distress syndrome and congenital anomalies. So we see that in respiratory distress syndrome, what happens? Generally, guys, if the baby is healthy, this oxygen will be supplied to the brain. In cases of respiratory distress syndrome, the oxygen supply to the brain is diminished. Oxygen supply is diminished. Why is there a diminution in oxygen supply? Because the surfactant which is supposed to be present in the lungs is no longer there. The surfactant is not present. So this alveoli will become very thickened and inflamed. So the oxygen exchange doesn't occur. Okay, and as a result the blood cannot supply the oxygen to the brain. So we have respiratory distress. The oxygen supply is not done adequately to the brain, so the respiratory distress syndrome can lead to the death in the baby. Postnatal causes and the congenital anomalies as well can result in the death. The prematurity, respiratory distress syndrome, certain alimentary infections, respiratory infections, congenital anomalies are of the causes of the postnatal period. So let us summarize the causes. Antenatal causes. We have systemic maternal diseases like systemic hypertension, diabetes, anemia. And then we have pelvic diseases, endometriosis, ovarian tumor. Anatomical defects, uterine anomalies, placenta previa, placenta abruptio, and we have toxemia of pregnancy, congenital defects. Then we have erythroblastophetalysis can also be a cause, that is blood incompatibility can occur. Antepartum hemorrhages, this is antepartum hemorrhages. So all of this. Next, we move on to the intranatal cause during birth. What all did we see? Injury can occur, or after the baby is born, asphyxia could be there, or also during the birth, during the delivery, obstetric complications can occur. Next, we have postnatal, after the birth of the baby. What are all the causes? Prematurity is one of the major cause. Respiratory distress syndrome can occur. See, we saw the respiratory distress syndrome, that is the postnatal cause, and congenital anomalies can occur. So these were the causes. Moving on to the social and biological variables. So we know that a number of social as well as the biological factors are also known to have been associated with this perinatal mortality. Even though their degree will vary in different countries, but they are known to have an impact or association with perinatal mortality. So these factors also will endanger the life of the mother. They can also result in high maternal mortality along with the perinatal mortality, along with the death of the the baby being born. Stillbirths plus the early neonatal death, it is also resulting in the death of the mother. Maternal mortality is also increased because of these factors, because they have a greatest impact in in the perinatal mortality. So if we try to manage these causes, if we identify or appreciate these factors, and we can by solving these we can reduce the perinatal mortality to an increased rates. So let us see what are all these social and biological factors which are resulting in these death. So we see that the lower socioeconomic status and the low stature of the mother. So we'll understand with the picture the low stature of the mother and the low socio-economic conditions. So you can see the low socio-economic condition and the short statured mother. And the high maternal age, okay, the maternal age being 35 plus. If the maternal age is 35 plus, high maternal age can be a risk. The pregnancy at this age could be a risk, and it is prone for maternal mortality plus perinatal mortalities, that is stillbirth plus early neonatal deaths. Next, we have low maternal age, both, okay, high maternal and low maternal. So you can see the first picture, under 16 years. Low maternal age could be one of the cause, or the late maternal age could be the another cause. So low is under 16 years and high is, so we see that low under 16, high is more than 35. Okay. High parity, fifth child or more. So we see that if the mother is high, having a high parity, 1 2 3 4, and now she's pregnant, fifth child or more, then or the multiple pregnancies can result in the perinatal mortalities. And next we have poor past obstetric history. If there are spontaneous abortions or 2 or 3 stillbirths continuously, so all of those, septic abortion, the bad obstetric history, if the mother is having stillbirths or early neonatal deaths are occurring, or the baby is dying in the one less than in 1 year, when the infant mortality is occurring. So all of these could be the bad obstetric history. And if the mother is a heavy smoker, if she smokes, okay, the heavy smoker also could be one of the cause for the perinatal deaths. And next we have the malnutrition as well as the severe anemia. You can see the mother is completely malnourished and anemia. Okay, these are the causes, social and behavioral risk factors which are having a greater impact not only on the perinatal mortality but also the maternal mortality, not just the baby but also the mother. There is a high risk of death. What are all the causes? Just look at the pictures and tell me now. We have low socioeconomic status. We have the low socioeconomic status. The maternal age could be high, that is more than 35 years, or it could be low, that is less than 16 years. Then we saw the high parity, many number of children, high parity, and multiple pregnancies could be there. And bad obstetric history, if the mother has a bad obstetric history in the past, like stillbirths, neonatal deaths, or premature babies could be born, and the infant could the death of the live baby born. And then it could also be the heavy smoking, the malnutrition, severe anemia, and one thing what we forgot was the short statured women. Okay, the short stature. So these are the causes of the other social and what was that, social and biological variables. Yeah. Next, we are moving on to the prevention. So now, how do we prevent this? Now we saw the various causes, and we saw the death rate, 23 out of the 1,000 live births are being dead. So how can we prevent these from occurring? That is, the prevention can occur at 3 levels. That is before pregnancy, or it could be during pregnancy. And the second level, you can prevent it during and soon after the delivery. Or the third prevention has to be done during the first month of life. So the prevention can be done at all these 3 levels. At this level, how can we prevent it? By well timed, well spaced, and wanted pregnancies. So what are they saying? Well timed pregnancies, that it should occur during the reproductive age group. So we know that the cause of the death is less than 16 years and it more than 35 years. So we have to make sure that the pregnancy is occurring between this period, between the healthy reproductive period it should occur. Okay, it should be from more than it is best to have from 20 to 30 years in this age. Okay, it is good. So we have to make sure it is well timed and well spaced. What do they mean by well spaced? The space between one baby and the other baby should be of minimum 3 years. Okay, minimum 2 to 3 years gap should be given between the two babies. It should be well spaced, and it should be a wanted pregnancy. It should be well planned and wanted pregnancy. It's not just unwanted one. Then only if it is a wanted pregnancy, the care also will be taken adequately by the couple. So we have to make sure that it is a wanted pregnancy. Encourage the wanted pregnancies. How can you encourage the wanted pregnancy? By providing the contraceptive methods, by educating the couple about the contraceptive method, so that they can plan their baby accordingly. So the well timed, well spaced and wanted pregnancies has to be done. That is how you can prevent the perinatal mortality. Next, we have the tetanus immunization, also the rubella immunization. All of this has to be done. The immunization has to be provided. And next, the prevention and treatment of anemia and infection. So we saw in the antenatal causes, anemia was one of the cause. So we have to detect anemia and treat the mother by providing iron and folic acid tablets. And if there is infection, you have to diagnose and treat the infections. So tetanus, rubella immunization has to be done. And also if there is HIV, we have to prevent the transmission of the mother to child. Transmission of the HIV has to be prevented, and the mother should be well nourished. We have to make sure there is a healthy mother, and you have to uh, you know mm, uh, encourage her to have a pregnancy which is free of drug abuses, which is free of tobacco, alcohol use. So the female has to be educated regarding the pregnancy. You have to prepare her. So we see that before and during pregnancy, these are the things, before and during pregnancy. Next, we also have the early detection and treatment of maternal complications. Any complications, if they are present, we have to detect them and treat them. And also the infections like hookworm infection, syphilis, STDs, sexually transmitted diseases, malaria. All of this has to be prevented, and you have to treat it. HIV counseling has to be done so that you can prevent the mother to child transmission. And good diet has to be given to the mother. And this is the care you have to take before pregnancy and during pregnancy. So before pregnancy, how? By giving the contraceptive methods to space the children, to have a wanted pregnancy, and then correcting the anemia of the mother who is planning to get pregnant. If she's having any infections, diagnose them and treat them. If there's HIV, counseling has to be done and treatment has to be given. So all of this is done before and during pregnancy. Next, let us see what's happening during and after delivery. So during and after delivery, safe and clean delivery has to be done. Okay, the safe and clean delivery has to be done by the skilled birth attendant. So you can see that the skilled birth attendant has to perform the safe and clean delivery. And you have to make sure that there is an newborn cord, eye and skin care has to be taken care of. The cord has to be cleanly cut using a sterilized scissor, or the equipments. You have to use the sterilized equipments and cut the neonatal cord, the baby's newborn cord, and then you have to clamp it. And the eyes, the cotton wool pads, we clean the eyes of the baby, and we put the ointment in the baby's eyes. And then the skin care also has to be done. Soon after the birth, the baby has to be cleaned well, so the skin care also has to be done. And the early initiation of exclusive breastfeeding. So multiple times so far we have studied about the exclusive breastfeeding. As early as possible. How early? That is 30 minutes soon after within the 30 minutes, within the half an hour of the normal delivery, the breastfeeding has to be initiated. And also, what are the other care you have to take during the delivery or soon after the delivery is that any complications, if they are occurring in the newborn, you have to detect and treat them. And you have to give a special care for the infants who are having these, it could be the smallest complication, you have to make sure that the special care, you have to keep the baby in the intensive care units, and you have to give special care to the baby who is born with certain complications or infections. You have to control the infection in the baby, and you have to also make sure that emergency obstetric care is provided. If there is some fetal conditions or complications, you have to give the obstetric care, and you have to manage this fetal complications or the delivery complications. And this is about the care during and soon after the delivery. Also, soon after the delivery, you have to counsel the mother about the home care and what are the danger signs, and when the woman has to come up for seeking the care. Okay, you have to encourage her for the follow ups, and you have to teach her. Also, you have to teach how to, they don't learn, we don't have any coaching sessions for the mother when she becomes pregnant. So you have to teach her during the soon after the delivery. You have to teach her about the breastfeeding, how to hold the baby, how many times to breastfeed, how to understand when the baby, the cues of the baby has to be understood by the mother. She has to be taught about the cues, and breastfeed the baby on demand. All of this has to be taught. You have to counsel the mother, and also the contraceptive method, you have to encourage the contraceptive method. So this is soon after the delivery. You can by doing all of this, by detecting and taking the early steps, by taking the measures, by preventing the complications, you can prevent the perinatal mortalities. Our main goal is we have to prevent the baby from dying, so we have, or the mother from from the mortality. So what we do, antenatal, all the care we saw, what all is done, and during delivery also we saw any complications, and after the baby is born, the cord, eye and skin care and everything. Next, we have during the first month of life. So we know from 1 to 28 days, the neonatal period, we have to what are the care which is taken so that we can prevent the perinatal mortalities. So we see that early postnatal contact has to be done, and the promotion and support of exclusive breastfeeding, like we saw soon after the delivery and also the first month, there must be the promotion of exclusive breastfeeding. No water, no honey, and all of that liquids you are not encouraged to use. You only have to give the breast milk to the baby. Exclusive breastfeeding has to be done unless it is medically indicated. You have to not go for other things. Next, we have to do a prompt and early detection and treatment of the newborn infections. We have to manage the diseases in the newborn infants and give the immunization to them. Okay, immunization is another important thing. So this is the prevention. And we have the abortion and stillbirth is accounting for about 10% of the wasted pregnancies. So out of the total pregnancies, the 10% of them are wasted pregnancies, that is the stillbirth and the baby is dying after the within the 7 days. So they are wasted pregnancies. The expected number of total pregnancy in 1 year will be the total number of pregnancies plus this 10% wasted pregnancies. Okay, total pregnancies plus the wasted pregnancies compromise the total pregnancies in a year. The auxiliary nurse midwife ANM should have a record of at least 50 pregnancies should be registered with her. So we see that at least 50 pregnancies should be registered by the ANM. So this was all about the perinatal mortality. Let us revise the MCQ questions. What did we see? Yeah, the postnatal cause of perinatal mortality is the most common cause is the premature baby is the cause for the perinatal mortality. Okay, so the premature babies who are born with a low birth weight, they are the cause of death. Next MCQ which we saw was the definition, the perinatal mortality rates definition, that is the death from 28 weeks of gestation to 1 week of life. It includes the late fetal death, late fetal, after 28 weeks it is dying, so obviously it is late fetal death, and the stillbirth, and early neonatal death, that is 1 to 7 days, early neonatal death per 1000 live birth. It is also an indicator of obstetrics and pediatric. In the pediatric, under the pediatrics, we have neonatal care, which is given before and around the time of birth in the country. It is an indicator of that what level the care was given. And in India, 23 out of this 1,000 live birth are dead. 23 out of the 1,000 live birth, the 23 of them are the perinatal mortalities. That is, the death is occurring. The stillbirth plus the early neonatal death. Okay. So I guess that's all are the MCQs. Yeah, the viable baby. This could be a short question. Okay. Viable baby should measure more than 1,000 grams, which is equal to 28 weeks of gestation. And in case both the criterias are not present, when you measure the length of the baby, it should be more than 35 centimeter. Okay. So with this, we come to an end of the perinatal mortality. I hope everything is clear. If you have any doubts, put it in the comment section. And if you like the video, hit the like button and subscribe.